Hello, how are you? No, I am not Dr. Jones. He is actually currently finishing up a procedure. Our patients absolutely come first. So I am just going to get on so that I can answer a couple of questions for you guys before he does join us. And just anybody who doesn't know, my name is Alana, and I am the practice manager here at Muse Plastic Surgery. I am also the patient advisor, so I do see all consults for their initial consultation. So I am really excited to see some of you. I know a lot of you guys are going to come to our event on Saturday, which we are really excited about. So I look to see you then and doing some consultations there. But you also will have time after that to still book a consultation with us so that we can talk about everything, talk about your goals, your expectations, and then definitely get you on that schedule for your procedure. Again, our lyric music lounge and consultation experience is going to be this Saturday, which is August 29th. And that event is going to be held here at our office from 4 to 9. So we really do look forward to seeing you guys there. I would love to get ready to jump in some questions. So as soon as they start kind of coming up on my screen, I'm going to go ahead and address those for you guys. Okay, so one of the questions I have is, do I need to lose weight before seeking liposuction or other plastic surgeries? I'm going to be honest with you, that really is going to depend on your goals and expectations. So if there's a goal weight you have in mind, let's get there before we do your surgical procedure. That way, after the procedure, we're not dealing with any excess fat and or loose skin. And when it comes to getting to your goal weight, yeah, maybe you may be 10 pounds away from it, 5 pounds away from it. That's actually a good range. So within 5 to 10 pounds of your goal weight, that is definitely a good time to have surgery. If you're beyond that, you may want to wait until you meet your goal and then have your surgical procedure afterwards. And that's just going to ensure that you have better results. And of course, it's also really important to keep up those results after surgery as well. Let's see another question. Why is protein drink so important prior to lipo? That's a great question. And it's actually not just liposuction, it's any surgical procedure. Protein really aids in the healing process. So, what we recommend is about 2 weeks before surgery, if you can increase your protein intake by at least 100 milligrams a day, that's really going to be helpful because that puts your body at a better place for healing. And that protein is already in your system. So, it's going to aid in the healing process. And then, of course, during the post-op time frame, it's going to be important for you to continue to add that protein to your diet because all that's going to do is make sure you're maintaining your strength during the post-op process. And I hope that answered your question. All right, we have another one. Do we do dimpleplasties? That is something that we can do, but our focus is the abdomen and shaping the core, refining the waist. So yes, we can do a dimpleplasty. We want to make sure that you're a good candidate, things like that. So that's definitely something that we can talk about during the consultation. So we can do that. Is that something that we do all the time? No, but it's absolutely something that we can address for you if you're interested in that procedure. Will I be reading the questions you submitted? Yes, we will. And as they flash across my screen, I'm just going to go through them and answer them to the very best of my ability. Okay. So yes. So, with our event, I wanted to kind of bring that up again. Our event that we're having Saturday is focusing on our lyric music lounge. So, it's really a space for us to kind of get together, for us to eat, mingle, network, enjoy each other's company, and also talk about some things that maybe you're not comfortable talking about in a regular space. You are going to be at our office. So, there are any questions that you have for me, because of course I will be there. Dr. Jones will be there as well. So you will even have, some time to, talk with him and ask him some questions, me as well. We also are going to have some past patients that will be here too. So again, maybe some people aren't comfortable talking to me or comfortable talking to Dr. Jones just yet. You may just want to have a conversation with a previous patient. That's fine too, because that's going to allow you to see what their experience was. And again, it's not just about their results. results. It's about the whole experience. So the consultation, surgery, post-op, all of that matters because here at Muse, we really do want you to have an amazing experience from start to finish. So we do try to foster that in the best way possible. Okay, I just had another question come in, so I am going to address that. Someone is asking, what is the downtime for a breast lift with implants? We are going to put you on lifting and working out restrictions for the first 6 weeks post-op. Not that your life is completely put on pause for that time frame, but I do want you to be careful because we don't want you lifting heavy things. We put implants under the muscle so everything is connected. And it's really important to allow your body that time frame to heal so that we're not causing any additional issues and we can allow your results to truly be what they need to be. So 6 weeks again would be the full downtime for working out and lifting, but most people honestly are back at work at about a week to a week and a half after a breast lift with implants. And of course, during your consultation, we will absolutely go further into detail with that just because every case is different. Sometimes we need to do a periola lift, other times it's the anchor shape lift. So, of course, when we are examining you, we are going to make sure that we're putting the best plan in place for you and for what you're looking for in terms of your goals and expectations. All right. The next question I have, I've lost 35 pounds. I'm considering a breast fat transfer, removing skin from, I'm sorry, the question disappeared. I believe they were asking about removing skin from their inner thighs, in addition to some neck wrinkles, eye drooping, and in the face area. They're wanting to know if all of these procedures can be done at one time, excuse me, and what the cost is. So I will be very honest. Your safety and your health is absolutely our number one priority here at Muse. So we do not go over a certain time in the operating room. So during the consultation, you can have, a long list of things. It's perfectly fine. We're going to go over each one of those. And for me, when I'm seeing you, I really want to know what bothers you the most. And whatever bothers you the most, that's the procedure that we should address first. And then we will get to everything after that. So again, no, we can't do everything at one time. So for example, if I have a patient who's wanting to get her breast, her belly, and her butt addressed, we're only going to really focus on two things. And the best way, because you can get all three done, just not at the same time. The best way to address that is for us to do perhaps the tummy tuck and the BBL first. And then as soon as 3 to 4 months later, you can always come back so that we can address your breast. So again, for us, safety and health is our number one priority, and we don't want to go over a certain amount of time in the OR. So yes, things can be addressed, but a lot of times we need to split them up because again, safety and health is our number one priority. And I also know everybody's here to see Dr. Jones. I promise you, you will not see me this whole time. I'm just coming in to answer questions just until he's completed with his procedure, and he will absolutely take over. But again, I just wanted to answer as many questions as possible so that he does have that time to finish up his procedure. So the questions that I'm getting were actually submitted to us. Some were submitted on our website. Some actually could have been from the last Q&A that he perhaps didn't get a chance to get to. So those are usually the first couple of questions that we kind of go through. But if you have other questions, please feel free to give the office a call. I can answer them directly, or you can send some to the DM as well. And if they're not addressed this evening, we will make sure that they're addressed at the next Q&A, because this is definitely not the last time. We want to see and engage with you guys as much as possible. Good evening. How are you? And I'm responding. I'm not responding just to respond. There are some questions and things that are coming up at the bottom of my screen, so I am responding to those. And again, you guys can keep those questions coming because I do see them, and I will, like I said, if I see a question, I'm definitely going to address that for you. You can also put some questions in the comments as well, so please feel free to do that. Wonderful. I have two questions. How do you check a person's health to ensure they are a candidate for surgery? Also, if I'm coming in from another state for a tummy tuck, how long would I need to stay? Those are great questions. Before any surgical procedure, we ensure that we have an EKG, medical clearance, as well as lab work prior to us actually moving forward with the surgery. Once those results kind of filter in, things like maybe your A1C. If your A1C is above a 6, we're going to pause really quick because we want to make sure that your numbers are stable, because anything below a 6 is safe. Anything above a 6, we need to use a little bit of caution. And like I said, safety and health is definitely our number one priority. So we don't cut any corners there. I want to make sure that your EKG is fully normal, and then that your doctor is aware of the procedure that you're having and that they are comfortable with you proceeding because there are no other lingering health issues or no other health risks that they think the surgery would cause any issues. So we definitely want to have that information before we move forward with your surgery, because again, safety and health is a number one priority. Now, as far as traveling, when we have patients that live further away, like California, New York, Texas, they typically stay a full week here in Georgia, because at that time we're able to do a few things. We're able to see you for pre-op, you'll have your procedure, and then the following week you'll come back in for your 1 week follow-up. After that, you're free to go home, and we will see you at your 1 month follow-up. So most patients stay a week. Now, my surrounding states like North Carolina, South Carolina, Tennessee, and Alabama, it really depends. Sometimes they're like, I'm really not that far away from home. I can kind of drive. We still, though, don't want you to go home the day of surgery. So we do still recommend that you stay a couple of days, maybe about 2 to 3 days, and then you can travel home. But even with your traveling, we want to ensure that you're wearing compression socks, you're doing the foot exercises that Dr. Jones shares with you during pre-op, because we definitely do not want to have any blood clots. We want to mitigate that risk to the best of our ability. So again, when you do have your consultation, that's something that we'll go over thoroughly, because if you have additional medical issues, we're going to want you to stay a full week. If you're healthier, we may say, okay, you can, go home a little bit sooner. But all of that is going to be created depending on each individual patient, as each patient has different medical needs and different needs overall. So we really cater to each patient individually. Perfect. Would you recommend a breast reduction prior to a woman having children? That is a really good question. Majority of patients that come see us are pretty much done or completed having children. That way, whatever is done is going to last for as long as possible. But things happen. So if you happen to get a breast lift or a breast reduction or even breast implants prior to having children, it's never going to stop you from having children, nor will it stop you from breastfeeding. You can absolutely successfully breastfeed with implants in. Just understand that if you get your breast done first and then you have a baby, there also can be changes here, because as you know, the breasts get larger, they fill up with milk, and then they go down. So you might need to come see us again for a lift, and that's okay, because we're not going anywhere. So you can, but most people do wait until they're completely done having children. That way they can really just enjoy the longevity of those results. Okay. The next question: how long after ab-X and lipo procedure can a person get a tummy tuck? So with a liposuction procedure, we just want to make sure that you're healed and that there's not a ton of scar tissue there. So we do want you to wait at least about 3 to 4 months after liposuction for us to kind of see if you're ready to move forward with that tummy tuck stage. Just because with the tummy tuck, it's a little bit different. We are cutting off your blood supply. We're, manipulating skin. We're also doing muscle plication. So at least a good, 3 to 4 months after a regular liposuction procedure, you can get a tummy tuck. Now, in our office, what we do with the tummy tuck is we do liposuction with the tummy tuck, because we don't want to just address the front portion of your abdomen. We want to make that holistic and address your waist and your mid back. So with us, we're going to do the tummy tuck, muscle plication, which is a double muscle plication. So they're not going anywhere. They're going to stay nice and tight. And then we're also going to follow suit with liposuction of your waist and your mid back. So most people that get a tummy tuck with us, they don't need necessarily lipo after the fact, because we've taken care of that. Now, what does happen sometimes is there's a little fullness in your abdomen, and every patient is different. When we do the tummy tuck, we only liposuction 2 areas, which is the waist and the mid back. Because we are cutting off the blood supply at the lower portion of your abdomen, you only have healthy blood supply coming from the top portion. So we don't want to add liposuction in to interfere or mess with that. We really want your body to do its thing in terms of healing. So we don't do liposuction to the abdomen, upper abdomen or lower abdomen, but we do the waist and mid back. So somebody who had gotten liposuction beforehand, maybe they got upper abdomen and lower abdomen, they can absolutely get a tummy tuck, but they should wait about 3 to 4 months in between those two procedures. Is there a BMI requirement for a breast reduction and lift? It is, because we're putting you to sleep and we truly want to mitigate the risk of additional complications after surgery. So for us, we have capped it at a BMI of a 31. As long as your BMI is a 31 or below, we are definitely moving forward with surgery. Now, when it comes to the consultation, we'll definitely take you at a BMI of a 32 for the consultation, but prior to surgery, I do want you to try to work on getting to that 31. So again, we are truly mitigating the additional risk and complications with the higher BMI. Okay, the next question. I believe we had this question already. It's what is the downtime for a breast lift with implants? But I will go over that again because I'm sure other people have joined the live. So to answer that question, 6 is going to be what I like to call our magic number. For the first 6 weeks, there is no lifting heavy, over 15 pounds and no working out. But majority of people are kind of back at work within a week to a week and a half, still making sure that they're being cautious of those lifting restrictions. Okay. Do you perform tummy tucks without drains? How do you determine if a patient's eligible for that type of tummy tuck, and how many have you performed? I personally have not performed any, but Dr. Jones has performed thousands. And I actually love explaining this because it truly does make a difference. The difference between a tummy tuck with drains and without drains is really all about technique. So, in a tummy tuck with drains, what happens? Once your muscles are repaired, they go ahead and they put the drains in place. Okay. They do this because at the end of the day, it really does make sense. They put the drains in place because they understand that when they're laying the top layer of skin down, there's nothing holding or anchoring it together. So the drains are in place. Over time, it's going to fill up with that fluid, and the fluid can be eliminated by those drains. Okay. Nothing wrong with that. However, we take it a step further. It may take Dr. Jones about an additional 30 to 35 minutes to complete in the OR, but it is absolutely worth it. What we do here at Muse is once your muscles are repaired, there's no need for us to put any drains in place because as Dr. Jones is laying that top layer of skin down, he's using progressive tension sutures to basically collapse that space. So what he's doing basically is laying, sewing, laying, sewing, laying, sewing. So there's really no room for that large fluid accumulation to happen because he's fully collapsed that space. Now, that doesn't mean that your body can't make maybe a small superficial pocket of fluid because that could happen. However, you have to wear a compression garment or a faja after surgery. So when you're wearing that, that truly does mitigate that risk as well because everything is nice and tight. Not tight to the point where it's uncomfortable, but tight to where it's doing its job. I like to call it giving you a supportive hug because that's exactly what the garment feels like. And that truly helps. And we do, of course, want you to wear that for quite a few weeks post-op. And we'll walk you through that process in terms of what that looks like. So, and the drains are also amazing because, or not having drains is amazing. I know me myself, I couldn't imagine having drains when I had my tummy tuck. I feel like I would have gotten it caught on a door. One of my kids would have been pulling it. So just eliminating that altogether is amazing. And then I don't have to carry a bag on top of my garment. It was just a very easy procedure. So that's the other reason why it's just a lot easier for the patient to deal with. And so the next question, how long does a tummy tuck with lipo usually take? So in the OR, that procedure, because like I said, we do a lot. We actually call it the Rolls Royce of tummy tucks because we are doing the tummy tuck, the muscle plication, liposuction of your waist, and liposuction of your mid back. Normally, that takes about 3 to 3.5 hours in the OR. For you, it's going to feel like 2 minutes, but of course, for your support waiting, they're going to feel that time. But that's typically the amount of time that you would that we take to do a tummy tuck procedure or an abdominoplasty. Okay, I'm interested in a mommy makeover. Is this procedure done in one setting? And please explain what's included in the mommy makeover. Great question. We do a mommy makeover, and we have what I like to call two combinations. With the mommy makeover, we either address your breast and your belly, or your belly and your butt. Remember, I had said before we can't really do breast, belly, and butt all in one procedure because safety and health is our number one priority. But when we're looking to address things, that's typically the category that we're going to be in. Okay, so it's either breast, and that can be breast reduction, breast lift, breast implants, breast lift with implants, and a tummy tuck, which also, of course, comes with liposuction. Or that would be a tummy tuck, liposuction of your waist, liposuction of your mid back, and a BBL, which, of course, is a fat transfer to both the butt and the hip area. So I hope that answered your question. All right. How well does fat transfer to the breast? What are the risks and how often does it occur? That is a really, really good question. And as you know, with Dr. Jones and I, we are very honest and very transparent. Doing a fat transfer to the breast is good because again, if you don't really have volume, that is one way to add volume. However, it doesn't always stay as nicely as we put it, to be completely honest with you, meaning that at least 50% of the fat, anywhere from I would say 40 to 45%, maybe not 50, but about 40 to 45% of the fat that we put in, over time, it naturally goes away. Okay. So while, if you don't want a foreign object in your body, you can definitely do a fat transfer. I also just want to manage expectations because they don't always look as pretty as they do when you first get them done because some of that fat really does dissipate. Okay. In terms of the risk with any breast procedure because of lifting and things like that is hematoma and seroma. And then fat necrosis is one other thing for a breast procedure, or excuse me, fat transfer to the breast. And I'll be honest with you, we don't do a ton of them because most of our patients are either just getting regular lifts or they're doing lifts with the implants. But it is something that we can do. And there have been patients like, I just want a little bit more volume. I'm not looking for a large amount of volume. I just want a little bit more volume. So if you're looking for that, then yes, we can definitely do a fat transfer to the breast. But again, just managing expectations, it doesn't always stay as plump as we'd like it. Are massages important after lipo? Yes, 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 and yes. They are. We do want you, especially after lipo, with a tummy tuck, due to the fact that it's drainless, we're going to put a little bit of a timeline on that. So you're not going to be able to get lymphatic massages with a tummy tuck until you're about 6 to 8 weeks post-op. However, with liposuction, we like to see you 24, no later than 48 hours after surgery so that we can do one or two things, do a manual lymphatic massage if necessary, or we're going to use the machine that we have for it. So either one of those things are extremely important after liposuction because we want to help with additional swelling and contour and also make sure you're not lumpy bumpy. So massages after liposuction are very important. And like I said, just with the tummy tuck, they're important as well, but there's a timeline so you don't have to focus on that until you're a little further out post-op wise. Okay. Do you have accommodations for patients who don't have anyone who can pick them up? So we don't personally have a service, but there are services out there that our patients have utilized that absolutely are amazing. So if that's something that you need, once we speak after the consult, all of that information is emailed to you so that it is at the tip of your fingers so that you can reach out to those companies just to make sure that they are available for you at the time you're trying to schedule surgery. So again, it's not our office particularly, but it is offices that we've worked with and they've had great experiences with our previous patients. Because especially after any surgical procedure, we do not want you getting in a Lyft or Uber because you do not know them. You're under, anesthesia. So I just want to make sure you're fully and taken care of. So I definitely want somebody that you know, you trust, or a trusted service to come pick you up versus a lipo case. So yes. Yes, yes, yes. I see another question and they say, yes, massages are critical to lipos, speaking from experience. Thank you. I appreciate that. It is important, especially, like I said, for liposuction. All right. Another question. Is it true that after a liposuction procedure or a tummy tuck that the fat will be distributed to other places? To be honest with you, yes. Especially with, honestly, anytime we remove fat from our midsection or anywhere, we are born with a certain amount of fat cells. And depending on the way we live our life, they can multiply, okay? And there's nothing wrong with that. Things happen. But when we go into a specific area and we pull out that fat, normally the fat doesn't redistribute right to there. But again, you'd have to be doing things to make yourself kind of gain that weight. So if you've gained an exorbitant amount of weight after tummy tuck or liposuction, yes, it could perhaps go to your belly. But if it's like 5 pounds, 10 pounds, 15 pounds, you're not going to see that right in your belly. You may see that on your face, your arms, and it'll distribute to other places. But if it's a large amount of weight, like 40 pounds, 50 pounds, yes, you may see that redistribute back in areas that we pulled it from. Okay, so I have a surprise for you. It is no longer going to be me. Dr. Jones is here and ready. Just finished up that case, so he's going to be answering all the questions from here. I appreciate you guys' patience in the process and in the meantime, and it's really been fun answering your questions so far. I do hope that you guys are able to come to our event on Saturday. Remember, it is going to be this Saturday from 4 to 9. All right, here's Dr. Jones.
Hello, everyone. Not really a surprise. I'm sure you were expecting me. So I'm going to just jump right in here. I see a question that says, is it true that after, okay, it just changed. Do I need to lose weight before seeking liposuction or other plastic surgeries? Well, that depends on your weight. It is statistically proven and shown in multiple publications in the literature that once your BMI is over 30, your complication rate goes up. So I know that different backgrounds, different ethnicities are built different. We carry, particularly minorities carry their weight in different areas. We're shaped differently. But overall, regardless of that, your BMI is correlated to your complication rate. I've seen that in my practice as well, particularly with wound dehiscence or wound separation. Once you get over BMI of 30, that goes up. Surgery takes longer, a higher risk of blood clots. With that being said, it depends on the procedure. If it's not a major or a 6-hour case, you don't need to lose weight to get your BMI under 30. That's why we have to have a consultation so that we can give you advice that's tailored to you and your body, specifically for you. So do you need to lose weight? It just depends on where your weight is and what you're getting. Before seeking liposuction, that also applies to lipo. There is such thing as debulking that we do, where for larger patients, it's not about contouring, because in Georgia, there is a limit. We can only take out 5 liters of fluid at once. And that's a lot of fat. So in awake lipo cases, I prefer not to go up to 5 liters. I try to stay safe. Safety is always paramount with every patient that I deal with. So your weight loss depends on how much lipo you're getting and where you're starting, to answer that question. I just finished lipo, so it's a big workout. When you're larger, your procedure is going to take longer. It's more physical work for me. Well, I don't mind that, but we don't want to keep you on the operating table longer than we have to. All right, next question says, is there a time waiting limit for when they can drive on their own? And then the second part is, how long is the procedure for peach lift and bra? I'm assuming, or maybe breast lift. Okay, peach lift and breast lift. So I tell patients you can drive on your own as long as you're not on narcotics. Obviously, you want to wait 24 to 48 hours for the anesthesia to be eliminated from your system. But in terms of driving, you can drive. We don't limit our patients. Even if you had breast procedures, you can drive. It's not like you're going to be in a NASCAR race or doing something crazy. For the most part, you can drive, but you can't be under the influence of any narcotics or sedatives. How long is the procedure for peach lift and breast lift? By themselves, they each take about 2 to 3 hours by themselves. Again, everything depends. Some breast lifts need a lot of work. Other breast lifts need a little tweak and a little lift. So that depends on the breast lift. They usually take about 2 to 3 hours, and the peach lift also takes about 2 to 3 hours. And that's a fat transfer to the butt done in our signature way with minimal incisions and a nice waist hip ratio where the butt is round. It looks natural and flattering and not overdone, but also not underdone. What is the difference between lipo and liposuction? Nothing. Lipo is just short for liposuction. These are questions that patients have sent in prior to the Q&A session. Does anyone out there have any questions, additional questions for me? Surgery is fun. I tell patients to keep it in perspective. Most patients are nervous and excited, but keep in mind, this is not heart surgery. It's not surgery on your liver. We're not taking out your gallbladder. It's the fun surgery. It's the surgery to make you even more confident. Just remove some things that you don't want or enhance some things that you want to enhance. Okay, my next question that I have is, are 7 liters a lot to be removed with lipo? The answer is yes. So think about how long it takes your body to build up fat. That could take weeks, months, or years. And then all of a sudden you have 7 liters removed from your body within a span of 2 to 3 hours. That's a lot for your body to adjust to. So you can get a lot of fluid shifts and volume changes within your body, as well as electrolyte changes. So 7 liters is unsafe. Depends on the patient. If in awake lipo in the office, that's too much. So it is recommended that if you have over 5 liters removed at once, then you should be admitted into a hospital and observed overnight. Remember, the goal is to keep you safe. 7 liters, you need to be admitted to the hospital and observed. That can't be done with awake lipo. So is 7 liters a lot to be removed? If it's a tiny patient, 7 liters, think about that. They don't even have 7 liters. If the patient is large, BMI of 40, they could easily have 7 liters of fluid to remove or fat to remove. So yes, it's a lot. Okay, I have another question coming in. I'm interested to know what you guys want to hear about, like any topics that you would like for me to discuss either now or in the future. We also do Muse Talks. That's something new where we discuss different topics and we host it in our office. And it's just kind of a cool night where we just chill and enjoy discussing plastic surgery. You get to meet the staff. You get to talk one-on-one with me and have questions answered. So the Muse Talks is also something new that we're doing, and that allows you to become updated on all of the latest and greatest in plastic surgery. So my next question is, do you only perform services in Atlanta? The answer is yes for now. We do have things in place to expand. We plan on moving to another state pretty soon, actually. We've already started the process. The other question is, I have a hernia and my doctor has told me the remaining option is to fix it is a tummy tuck since the mesh repair failed. So you have a hernia and your doctor tells you that the remaining option is to fix it with a tummy tuck since the mesh repair failed. So that's not a standard way to repair a hernia. We don't have data on tummy tucks and specifically for hernia repairs. If your mesh failed, mesh relieves the tension on a hernia repair. So we always want a tension-free repair when we repair a hernia. And what a hernia is a defect in your abdominal wall and your intra-abdominal contents, whether that's fat, intestines, that can pop through that defect, pop out. And then you can see that under your skin. But when we close this hole or this defect, we want it to not be under pressure because then it can rip back open. So mesh helps relieve that pressure. Mesh is a better way to fix a hernia repair. The unique thing about tummy tucks is the muscle plication. So just this week, I fixed a hernia during surgery. And what I did is I closed it. We closed it with a tension-free closure. And then when I placate or tighten the rectus muscles in the middle, I close over the top of the hernia repair, and that reinforces it. So far, knock on wood, we have no hernia recurrences with that technique, and it works extremely well. But I wouldn't recommend getting a tummy tuck to fix a hernia. I would get the hernia fixed the correct way. There's also laparoscopic approaches. It can be done robotically, laparoscopically, even an open approach before getting a tummy tuck to fix it, especially a recurrence of a previous repair. What was that? Oh, do you have privileges in Houston, Texas? No, don't have any privileges in Houston. Um, and it says, I know you don't accept insurance, but is there a way to still submit a claim for items that were medically necessary? The answer is yes. So we have patients every year that, even though they know we don't accept insurance, they will later on, after the surgery, ask us for the medical records. They want the op report that I dictate, and they want all the medical records. They submit that to the insurance company, and we have had patients to get it reimbursed to them, particularly with breast reductions. Some of those can be covered. Insurance companies typically want you to remove a certain amount of breast tissue, and they want the symptoms of the macromastia or enlarged breast documented prior to having surgery. So we do all of that. And if you want your records, we give them to you and you can submit for insurance claim. How does fat transfer to the breast work? Do you have to transfer fat? So fat transfer to the breast works by choosing a donor site, which is the location where we're going to take the fat from. That could be your abdomen, it could be your waist, your thighs, wherever you want it. And then we graft or transfer the fat into your breast. Fat grafting or fat transfer to the breast does not work as well as fat transfer to the buttocks. So typically with a fat grafting to the breast, you're going to lose in all about 50% of that transfer. The other big risk with fat transfers to the breast is fat necrosis where if we transfer a lot of fat, some of that fat won't survive. And the fat that doesn't survive becomes calcified and fibrotic, and you can feel hard nodules in your breasts. With that being said, fat grafting to the breast can be done well. I prefer to not do it for large volume enhancements, but for refinement over a breast implant or a small volume enhancement, fat grafting works really well. So um, there's a role for fat grafting, but a lot of patients don't want breast implants, and I understand that. I try to avoid breast implants at all costs, but I do them almost every week because it's our best option for large volume enhancement, upper pole fullness with breast lifts, or just a breast augmentation that needs a significant amount of volume enhancement. Implants is my preferred approach. So, fat grafting is more supplementary and complementary to the main procedure that I perform. It's very useful for breast reconstruction patients that have had flaps or implants, palpable device underneath. So it can smooth out the edges around the visibility. It can enhance a little bit more volume. So definitely a role for fat grafting to the breast, but no, I don't prefer to do large volume enhancement with fat. If I have loose skin on my back, would lipo help with that? No. The short answer is no. Um, this gets a little complicated, but I'm going to try to explain this because I have patients with loose skin on their back and they don't have much fat. Why would they do lipo? Because liposuction is essentially for fat removal. When you have loose skin on your back, you tend to have bra rolls. The bra rolls have creases. There are these horizontal creases in your back, and over time they become chronic. And what these represent is a fibrous zone of adhesion underneath the skin that is adhered to the chest wall in your back. So the benefit that I've gotten from doing liposuction on the back with people with loose skin is trying to break up that crease. Let's say there's a um, like an indentation, like this is the crease. I go underneath and I try to break up that crease to allow it to pop up and allow that skin to redrape. Even though it's loose, it can redrape and not be a big indentation where the skin just wants to flap over that crease and hang down over that crease. So I try to eliminate that zone of adhesion with the liposuction cannula. It doesn't do much for the fat. It puts you at risk for contour irregularities, but if your surgeon is careful and knows what they're doing, then it could be beneficial. We also have non-invasive treatment for loose skin. So my patients who have loose skin and want back liposuction, we do liposuction in addition to skin tightening, and that works pretty well. That avoids you having to get a back lift. At a certain point, if you have a ton of loose skin, then a back lift would probably be your best option, but you're compromising having a scar. So you're going to have a large scar across your back. I tell people that a back lift is like a tummy tuck for your back. So think about the pros and cons. If it's if the benefits in your mind outweigh the risk of that scar, then just get a back lift. If it's not so bad and you just want it tweaked, you could get liposuction to eliminate the bra roll. Let's continue this conversation on bra rolls because that's a common thing that I have to talk about in clinic. In practical terms, I think of bra rolls in two ways. This is how I explain it to patients. Think about chunky versus floppy or flabby. Chunky means there's a lot of fat in within the bra roll itself, and the skin may be healthy. You may not even have loose skin, but you have big bra rolls and they're chunky. So a surgeon can take a chunky or thick bra roll that looks bigger than a floppy bra roll and still get the back flatter because the skin is still tight. There's good elasticity. And remember, lipo is for the fat. So we're going in there, we're taking out the fat from the bra roll and it's getting flatter. And it can look really good and very smooth because they don't have all of those thick creases and zone of adhesions that someone with a flappy or flabby bra roll might have. So think about it in terms of floppy versus chunky. Typically, chunky has a more dramatic effect after lipo. If you're interested in having any procedure done, you're at the right place. Oh, thank you. They are extremely knowledgeable, professional, and patient. Results from my lipo is shaping perfectly. Oh, hey there. I know who you are. Um, I'm glad you're doing well. Outstanding patient. Everyone likes you and can't wait to see you back for follow up. I had an ABEX procedure at Sonobello. How long do I have to wait for a tummy tuck? I'm not sure what an ABEX procedure is at Sonobello. I think it may be their awake tummy tuck procedure. I'm not sure. If that is what it is, then I know that they don't do muscle tightening with that. And they typically don't translocate or cut around the belly button. Um, so I don't really know what an ABEX procedure at Sonobello. Some of these things are branded names and they could mean anything, but I think that's their awake tummy tuck procedure without muscle plication. If you've had that, I would recommend you waiting about 6 months at least before you have a tummy tuck. That's a great question. The next question is, do I use Exparel with the tummy tuck? All tummy tucks are not created equal. People know about techniques being significant, but they don't think about the medications and the other things in terms of patient care that can make your tummy tuck experience even better. Exparel is one of those things. So Exparel is a long-acting local anesthetic medication. It's fairly new, and I use it with 100% of my tummy tuck patients. So if you get a tummy tuck, you get an Exparel. Um, it has liposomes, little fat cells that contain the bupivacaine. Bupivacaine is the medication that's in it. The liposomes absorb it and it slowly releases that local anesthetic over 72 hours. So your post-op pain management is much, much better. I've came up with my own technique for how I inject it and where I want to inject it. And there are these key places throughout the abdomen where if I inject there, the patients have very minimal pain. A patient who came for follow-up today from a circumferential body lift was saying she was shocked. She had no belly pain. She said, I was nauseous. I did have shortness of breath. And she's like, and my back was sore. But I would have very little pain. And I was really shocked with that. And I was telling her it was from the Exparel. So everybody who gets a tummy tuck gets Exparel. Dang, it's been a long day. But with Exparel, it's expensive. It's an expensive drug. So a lot of surgeons may not use it. When you sign up for a tummy tuck, it's automatically included. Everything that helps a tummy tuck, you get. That's why we call it the Rolls Royce tummy tuck here, because you get all of the bells and whistles. You get the Exparel. When I tighten your muscles, I do what's called a 4X muscle repair. So I use a double-stranded suture. So there's a needle and it has big, strong stitches attached to it. And then I tighten up your muscles with that double-stranded stitch. So it's extra strong. Then after I'm done, I go back and I tighten it again the opposite way. So you essentially have 4 strands of suture holding your muscles together. There's no way you're gonna rip it. I decided to do that because when I first started my first few years, patients will call and say, I coughed. or I fell and I heard something pop. Did I pop my stitch? And the truth is, surgeons have no clue if you popped your stitch or not. We don't know. We just have to wait and see how you do. So I never knew, and it was a difficult question for me to answer to patients. They'll be freaking out. So then I came up with a technique where I know that you can't pop it. So you're not popping my placations. No way, not popping it. So you can fall, you may hurt yourself. It may hurt your abdominal wall, but you're not gonna pop a stitch. So now, if I get that call, I rarely get it now for some reason, but if I do get it, they'll ask me and I'll say, no, you didn't pop it. And they'll wonder how do I know that? And I would tell them, you would have to basically rip all of the fascia off of your muscles. Because in addition to the 4 strands of suture, there's a certain way, a certain orientation that we can take the bites through the muscle fascia, where the pressure on the abdominal wall doesn't make the suture cut through the fascia. Instead, there's a bigger purchase on the fascia, so it's less likely to rip through. Yep. So next question is, what's the downtime for breast lift with implants? It's about 1 week before you can do desk work. I recommend 4 to 6 weeks before you can do manual labor and strenuous activities, because desk work is easy. So I recommend 1 week before desk work. That's the real downtime. But let's say you're a construction worker, or a personal fitness trainer, or a nurse who's going to be moving patients, turning patients. I recommend about 4 to 6 weeks. Also before exercising, 4 to 6 weeks, because a breast lift with implants, you're going to have incisions around your areola, down your breast, and we don't want your breast bouncing around everywhere, even if you're just jogging. You can walk, but we don't want them bouncing around. You guys will be surprised at the questions I get in the office, because patients will be like, what about brisk walking? I'm like, yeah, okay, what about jump rope? Like, people ask me all kind of things. So at a certain point, that's some gray area, and you got to just kind of use your own judgment. You got to have normal judgment. If you're ever confused, just reach out to us. You can call us, email us, and we'll be happy to clarify for you. So our next live music lounge experience is this Saturday, and it's going to be here at our office in our new music lounge, which is called Lyric. It's been a lot of fun, and it's the ultimate VIP consultation experience. So if you want a consultation, you can come. You can have a personalized consultation, have some food and some drinks, but you only drink after your consultation. But we have a lot of fun, and we want to give you an amazing experience, like something that you wouldn't anticipate, and you won't get anywhere else. So come to Lyric this Saturday, RSVP. You can go to our website, or you can go to my Instagram. What was that? Oh, okay. And it's in the chat. So come, have some fun. All right, guys. Thank you. Sorry I was late wrapping up a procedure, but it was good. We got a lot of fat out of there, and that's what we do. Shaping the core, contouring the race, refining the silhouette. Yep. All right. So we'll see you for our next live Q&A, and have a good evening and stay blessed.